And once you take the long view of like, you got to think about your body 40 years without hormones and make that decision soonish, if not today, soonish, because the hormones won't help as well when you start them when you're 84. That's not how hormones work. But yeah, that's the long-winded answer to the question of like, isn't this all natural? So like, yes, menopause is natural. So is dying pretty quickly after, about 5 to 6 years.
Hi, skin friend. Thanks so much for tuning into this week's episode of The Skin Reel. This week, I'm really excited to have this amazing physician, educator, speaker on, Dr. Kelly Casperson. Now, if you don't know who she is, definitely get familiar. She's a board-certified urologic surgeon, as well as a public speaker, sex educator, and host of the top-ranking podcast, You Are Not Broken. She is dedicated to empowering women through humor, candor, and science to demystify sexual health, intimacy, as well as midlife wellness. And believe it or not, this is not something we're taught in medical school. And Dr. Casperson says she didn't even learn this in her urologic training and residency as a doctor taking care of both men and women and their pelvic health. This is something where there's a lot of interest. And finally, I feel like the public is really demanding answers. And in this day and age, I feel like there is such an interest in learning about what happens to our bodies, especially during menopause and beyond, and how do our hormones play a role. We'll definitely talk about hormone balancing and whether that's a good thing or even possible. But if you are a woman, midlife, really any age, and you are curious about your hormones, you're curious about intimacy and wellness beyond your reproductive years, you're definitely going to want to check out this episode. Dr. Casperson, thank you so much for being here. You're a super busy lady, and I'm so glad to be able to get a little bit of your time today to share your insights with the audience. So thank you.
Thanks for having me.
You are doing a lot of different things, and you are a urologist by training, but I would love to know how you got into especially female sexual health and intimacy.
Urology is pelvic health, right? It's genital urinary structures, kidney, bladder, ureters, kidney stones, bladder cancer. Stereotypically, the male genitalia, we take care of the penis and the scrotum. I always thought the gynecologists were helping women with female sexual health, and I had a patient change my life. I helped save her from bladder cancer, really got bonded with her. She came into my office. This is about 6 years ago now. And she was, crying over her sex life. And as I was handing her a box of Kleenex, I realized I didn't know how to help her. And I was like, does anybody know how to help women? Like, we give the Viagra. Who's taking care of the people who are supposed to be sleeping with the people we give Viagra to? Is it true that the gynecologists know this stuff? Turns out the answer is no, for the most part, unless they got additional training. And just sort of deep diving, I just got obsessed with it because I was like, oh my God, there's actually a lot of research and nobody knows about it. And about a year after, I got to know enough where then I was like, I can't make a big enough difference just seeing people in clinic. I need to talk. And so the podcast is 5 years old, January 1st.
Wow, so exciting. Tell us the name of that.
You Are Not Broken.
I have to admit, I know doctors get very little dermatology training in medical school, but I'll tell you, we get zero about sexual health. I think the only sexual health I got was, here's how you prescribe birth control pills in my OBGYN rotation, right? I think that's the norm, right? And what I've just been amazed by listening to you and other people who are finally talking about women's sexual health is that even your gynecologist, who you would think, or your urologist, right? People you would think would have the training, they're working on those organs and learning about them. Even they don't have that knowledge base either, which I just assumed, like you did, like, well, yeah, like I'm sure the gynecologists talk about that kind of stuff. But I also have to say, like, I didn't even know like people would really bring this up to their doctors, right? It seems like in so many ways, it's so taboo.
Horribly taboo. Because we didn't get good sex ed, we think we're broken, right? And we're like, I don't have an orgasm with penis and vagina sex. And you're like, yeah, 70% of women don't. I don't always get lubricated. Yeah, lots of people don't. My erection goes away sometimes. Yeah, that's what erections do. right? Like, it's so normalizing once you understand the science and the art of sex that you're like, "No, no, we're actually just scraping along, putting together pieces of, like, what did your parents teach you? What did you get from your first boyfriend and when you were 17? Hollywood is, like, horrifically wrong. Porn's a complete performance, right? That's not real sex at all." And so it's like we're scraping together bits and pieces, and then we think we're the problem when, like, so much of this could be alleviated by good adult sex ed.
And I feel like probably a lot of people around my age, you've been married for a while, you're like, "I should know this. I should have this figured out by now," right?
Nobody offered any sex ed, so you're like, "This is all we know. I'm just bad at it," or "I just don't like it." That's a very common one, is like, "I must just not like sex." And it's like, maybe you've been eating, like, buttered noodles for dinner for 20 years and you had no idea, like, carrot cake was available.
That's a great analogy, right? Yeah, you just don't know what you don't know. It's important that we sort of lift this taboo off because, to your point, like we do have Viagra for men who are struggling with issues. Where's the support for women? And I am excited, especially as a woman who will be going through menopause in the next decade, that we're finally looking at this with a female perspective and looking at what women go through and realizing, like, okay, our lives don't just end when our periods end and that we deserve to have a healthy life longer. And I feel like this same thing with skin and how our skin health, our appearance and vitality and feeling good and looking good, I think it all can be related back to, giving ourselves knowledge and confidence and talking about these things.
Totally. I mean, Western medicine, we're really like the fix the disease organization, right? We're not really the, like, besides a mammogram and a colonoscopy, we're not really a, like, let's be proactive. The amount of women, midlife women, perimenopausal women who I see who went to their doctor and complaining of something, right? I don't feel like myself. I have low energy. I have low libido. I'm sleeping like crap, whatever. And they're told, you're not sick enough. Like, dismissal of what you have because it's not bad enough to actually, like, cause a diagnosis or require a prescription. It's like a gaping hole in taking care of people.
Well, and also you're in a surgical field, right? So it's almost like, well, do you feel sometimes, I don't want to put words in your mouth, but as a surgeon, like if I can't fix it with a surgery, then you are supposed to like transfer them to someone else or is it not your problem?
Well, I think more often people come to me. I mean, I'm a surgeon. My toolbox is surgery, right? And I'm like, dude, you need some vaginal estrogen and some pelvic floor physical therapy. Like, start with the basics. And it's like we skip over all of that and go straight to surgery. And like a good surgeon is like, no, you didn't fail any of the stuff that can make you completely better without surgery.
Why jump straight to that option? I mean, yes, surgery can be powerful and important for a lot of things, I'm sure, but maybe not the first step.
Yeah, totally. I mean, it's sometimes it is the first step, but the majority is like, what have you tried before you came to see me? Nothing, right? And it's like, God, your first step's a surgeon? To me, I'm like, I just think that's a messed up pathway.
Yeah. Well, I mean, that's why your podcast is so popular and your book and courses, right? To actually know, wait, okay, maybe there's another path first that I can try. And so, yeah, that's amazing. I want to talk about something I hear a lot about. I hear it in dermatology. I hear it really with I feel like every organ system, right? But hormone balancing. What is this term? Do you like this term? What does it mean? And how do you think about hormone balancing?
I think it's an easy way to kind of get an idea of what people are talking about, but 9 times out of 10, I think it's a marketing term. I had a perimenopausal woman. I was going off on something. I was like, there's no such thing really as hormone balancing because in postmenopause, you're kind of balanced because everything's zero. But in perimenopause, like, you're nowhere near balanced because, like, Tuesday isn't Thursday, isn't last month, isn't next month. Like, it's literally a roller coaster. And she was like, she started crying. And I'm like, "Oh god, what did I say?" And she's like, "I've been trying for a full year to try to be balanced." And I realized, like, people are using it kind of as a weapon with our, like, perfectionist tendencies to be like, "Am I balanced today? What about today? And today I'm balanced? What do I need to do today to be balanced? How do you know you're balanced? Who's the judge of balance?" Right? Like, it's this big nebulous thing, and I think it makes us easy prey for marketing, supplements, a bunch of bullshit. So, I don't wanna say, like, I get the word. I can't make the word go away. Technically, postmenopause is wonderfully balanced because you just have no hormones, right? And I don't think that's what people want. So it's usually a sign that like hormone experts don't talk about balance. So to me, I'm like, it tends to be a sign of either like a savvy marketer, supplement companies, or people who are trying to sell something.
I totally am with you. I was having this conversation with my GYN friends, and they were saying if you know anything about women's health, you know that our hormones are every month there's fluctuations. We're never in balance, right? And to your point, when your estrogen is essentially zero, you're balanced, but that's not really what we're going for, right? We were just kind of laughing about it. And I totally agree. It's kind of like clean beauty in the dermatology world, right? Like it's basically a marketing term, but essentially, if you don't put clean beauty on your product, no one's going to buy it, right? But it doesn't really mean anything scientifically, medically, it doesn't mean it's better. So, yeah, I hear that term all the time. And if you actually knew about like women's cycles and things like that, you know that we're never in balance. It's kind of like work life balance. That's really a myth, right? But it's something that we're told to strive for. So,
I think the other words that are really annoying me, natural super annoys me because you can put natural on a candy bar and charge twice the amount of money because it's meaningless. It just makes you feel good. The naturalistic fallacy that if something is from nature, it's better for you, which is completely not true. And then safe. The word safe is really irritating me lately because everybody's like, but is it safe? And it's like, what the heck does safe mean? Like, all medications have side effects.
everything has side effects. Choices you make in your life have side effects, right?
Medical professionals know what like risks include X, Y, and Z. The average person doesn't know that that doesn't mean those risks are going to happen to you, right? Because they're like, oh, it has the risk of blood clot. And I'm like, yeah, 1 out of 10,000, right? And so the whole like concept of is it safe, I'm finding very meaningless.
I haven't heard that one as much in dermatology yet. We'll see, but totally agree with the whole natural thing too, right? And we always say like poison ivy, totally natural. Arsenic, totally natural, right?
Dying in childbirth,
Very natural, right?
no pain meds with a femur fracture, natural.
Very natural. Exactly. Not fixing that femur fracture is natural. But segue a little bit, but I would love to hear your thoughts when people say, well, menopause, women's estrogen levels drop. And people say, well, this is natural, right? This is natural, AKA just deal with it.
It's the weaponization of natural, really, of like telling people what you think they should do, which is like none of your business. So that's my first problem with it. The second argument is menopause is completely natural in most organisms. I'm not just talking mammals. I'm talking yeast, fruit flies, lots of organisms. They live longer than their reproductive potential. That is an ingrained design. And it's not a design flaw. It's designed for a reason. We need you to outlive the mechanisms to reproduce so that you don't die while you still have potential, right? But another thing that irritates me is like, only 4 mammals go through menopause. No. If you take harbor seal, the longest living harbor seal is in the Portland Aquarium right now. It's 49 years old. Average age of harbor seals in the wild is 18. What does that mean? What that means is that thing stopped having babies a long time ago. And most mammals don't menstruate. They reabsorb their uterine lining. So it's actually very hard to measure who menstruates. But the point is menopause and outliving your reproductive potential is that's the design. That's natural. What's not natural is wanting to live 30 to 40 years after that. How is that seal living to 49 instead of 18 in the wild? Captivity. Clean water, steady food supply, vaccinations when indicated, no natural enemies. Look at what we've done. We've fixed trauma. We've invented antibiotics. We have steady food supply. We are living longer post our reproductive potential than ever before. And nobody's saying that's not natural. Let's stop doing it.
Right. What are we going to do? Like start killing everyone off sooner?
I just put in the manuscript for book number 2, which is like why all this is at the top of my head. But it's like, because I really want to fight against that grandmother hypothesis where we're like pandering to women and being like, oh, we're doing it because it's better to be a grandma. Yes, in societies, it's better to be a grandpa too, right? So that's not the reason why this is happening. The reason why is the development of antibiotics has extended everybody's life expectancy by 26 years per person. It's never happened this, like, and people be like, my great grandma lived to 80. It's like, yes, there's outliers, 100%. But not on a global scale like it's currently happening.
Well, and it's projected to just continue to exponentially increase, right?
I'm not here to convince anybody to go onto hormones. But if you're 50 and you're feeling fine, the question is, when you're 84, what do you want to be doing? Do you want to be recovering from a hip fracture, or would you like to prevent osteoporosis? Right. And once you take the long view of like, you got to think about your body 40 years without hormones and make that decision soonish, if not today, soonish, because the hormones won't help as well when you start them when you're 84. That's not how hormones work. But yeah, that's the long-winded answer to the question of like, isn't this all natural? So like, yes, menopause is natural. So is dying pretty quickly after, about 5 to 6 years after.
Yeah, no, totally agree. And I feel similar ways with aging and changes that we can see that we don't necessarily have to stamp out every sign of aging and make it totally go away, but there are ways to go about living where you can have vibrancy and health. I love this push towards health span rather than just like living longer. I don't want to just live long. I mean, my grandmother's almost 102. So I may be living for a long time, but I don't want to live where I can't carry my groceries and walk up a flight of stairs. I want to be living as healthfully as possible. So that's where I think having health span, and that's why I think doing things now, like in midlife, to improve where you are later in life is so impactful. Would you agree with that?
Yeah, I mean, I think it's all preservation of function at this point, which is not how traditional Western medicine thinks. So to really understand like why is this such a radical idea is because women get told you're not sick enough yet. Instead of how do we want to preserve function so you can keep being however it might be, athletic, sexually active, cognitively intact. How many like your brain is your life. Why aren't we doing everything we can to preserve it?
For women who are perimenopausal or really menopausal, if they're interested in taking estrogen replacement, is it safe, right? I just opened that can of worms. The whole women's health initiative and everything has been back and forth. I feel like my mom's generation got really screwed over.
The boomers are pissed. The boomers who know what happened are pissed.
Can you give us cliff notes, like a recap of what's going on and what are our thoughts on estrogen replacement today?
Yeah. So Women's Health Initiative came out in 2002. It was released to the media before it got published. That's a big no-no. Some of the researchers didn't get to read the final document before it got published. So the media got it before the scientists got it. And they said, we're stopping this study because of increased risk of breast cancer. And what the study actually showed is no increased risk in breast cancer. So estrogen alone arm had a 20 to 30% decreased risk of breast cancer. Why wasn't that in the news? That estrogen's breast protective. And the estrogen progestin arm, meaning synthetic progesterone, not what your body makes, the placebo arm was flawed. So in the placebo arm, there was less breast cancer compared to the other placebo arm and the estrogen arm. Why? Because some of those people were on hormones before. But if your placebo arm is flawed, because remember, they're not randomized for risk of breast cancer. This is a heart disease study. So breast cancer was a secondary outcome. They weren't randomized to that. But when you compared the estrogen progestin arm to the estrogen alone arm and the estrogen alone arm placebo group, it was the exact same. So in short, taking hormones doesn't increase your risk of breast cancer.
Get that message out there when the other message was it does, right?
That was the only message. It was never walked back on a grand scale. Multiple big thinkers currently think that the Women's Health Initiative was probably the most damaging thing to happen to healthcare in the last several dozen years. If you look at when hormones stopped, so 80% of women in this country were taken off their hormones in 2002. What's very interesting is, so that means 20% of women stayed on, right? Top 5 best-selling drug in the 90s. There was a time when 40% of all women were on hormones. It was called the 90s. We just forgot about it, right? So 80% got taken off. We still had 20% of women on. 10 years after the WHI, there was even less people on. Why? Probably because those prescribers who still knew it was safe and good started retiring. And we didn't teach any of the med students, any of the new residents, anything about hormones. So it actually continued to get worse for like a full decade. But now, and this is not measuring compounded medications, there's a lot of women on compounded medications. Only about 2.8% of women are on hormones. That was data released at the Menopause Society in 2024. 2.8% of women are on hormones. Not counting compounded because we can't measure that. Totally crazy.
Do you, in your experience, you think it's just people just don't know, or the prescribers don't know it's safe? Like, where's the hang up, or is it all of it?
Yeah, well, the zeitgeist ether that it causes cancer, so that's a problem. And then 2 decades of physicians not being trained. It's a hell of a lot easier just to not prescribe a medication when you have a 10-minute visit than to explain all of that, right? Like, I just took as long as a clinic visit takes to explain all of that. So the tides are turning. Absolutely, the tides are turning. But, think of it this way. If a man had a medication that decreased his risk of death between the ages of 50 and 60 and helped him live probably 2 to 3 years longer than people not on this medication, how many men do you think would be on that medication?
99.9.
So I'll ask another question. If you have a group of perimenopausal pre-diabetic women and you had a medication that decreased their risk of developing diabetes by 30% by 1 year, that would be a blockbuster drug that all insurance would cover, don't you think? That'd be a billion-dollar industry. Decrease your risk of diabetes by 30% if you already had prediabetes. Estrogen. It's absolutely nuts. It's not like, oh, it just makes your skin glow and sustain your orgasms, like, which is all good, nice things in and of itself. But, like, it's so astoundingly good to only have 3% of people on it.
Wow. So, say some of the other benefits, because I think sometimes people get stuck on, well, estrogen, it maybe helps with dryness, or, estrogen impacts so many different organ systems. So, you can just kind of share with us some of those.
And these are all studies. This is not me making this up, but 30% decreased risk of colon cancer, 50% decreased risk of heart attack, increased time to first heart attack if you're on it. There's a meta-analysis by Dr. Mosconi, I think 2023, showing if you start hormones early, that's age less than 60, but a 30% decreased risk of dementia. There's a Humana study showing correlation with decreased risk of all neurologic diseases. Like, estrogen and testosterone help your myelin. They help your nerves. They prevent tau protein tangles. Like, people have no idea that this is helps preserve the function of your body. Will it make you not age? No, you're still gonna age. Will you still get sick? Yes. Things happen, but at a much lower rate. If you get breast cancer, because breast cancer is common, if you get breast cancer and you're on hormones before you got breast cancer, you have a 30% decreased risk of dying from breast cancer.
If you've had a history of breast cancer, can you be on it, or is this something that, you really need to talk with your individual doctor?
Yeah, so vaginal estrogen, which is low dose, is basically skincare for down there, helps preserve the vulva, vagina, bladder. Everybody can be on vaginal estrogen. It's very rare. There are very rare cancers, so I can't say 100%, but it's very rare that you can't be on it. Most people are told they can't when they actually can. Their doctors just don't know the safety data. So vaginal estrogen, yes, cancer survivors are actually pushing it up to be like, even when you're on cancer treatment, you can be on vaginal estrogen. So vaginal estrogen's very low dose, doesn't go in your bloodstream. You can start that when you're 92. Use that for pain with sex, overactive bladder. Decreases your recurrent urinary tract infections by 50%. Right? It's amazing. So that's vaginal. Systemic hormones after treatment for breast cancer is coming along. Because currently, and people need to understand, I can't just say yes or no, I have to explain myself. Breast cancer is basically a curable disease at this point. Most is diagnosed in stage 1. Stage 1, 90 to 95% survival at 5 years. What's the number one thing that a breast cancer survivor will die of?
It's something heart.
It's heart disease. Just like the number one thing that Americans die of is heart disease, right? So all these survivors are like, great, you saved my life. What about my osteoporosis? What about my brain? What about all the things? So the best book for people to read is Estrogen Matters by Carol Tavris and Avram Blooming. They go into all the data on all the studies. There's basically one study that showed an increased local recurrence, but no increased risk of death, starting hormones after breast cancer diagnosis. No admission mammograms to that study. So flawed. The recurrence was within like a year or two. And they stopped the study early because it was right after the Women's Health Initiative. So big scare about that. That's called the Habits Trial. Because of the Habits Trial, that's why most people say no. We have multiple other studies, including the Stockholm trial, which was going on at the same time as the Habits Trial, but did not get stopped prematurely, that showed no increased risk of breast cancer recurrence when on hormones. So there's plenty of data to back you up if you want to be on hormones. It's just in the United States, we're afraid of being sued. I think that's a big thing about it. We're afraid of cancer recurrence, which to me, I'm like, listen, breast cancer is a bitch, man. It does evil. It comes back at 8 years. It does stupid shit, right? If it comes back, it's going to come back. I don't have any strong data to say if yours comes back, it's because you chose hormones. And in the meantime, do you want a quality of life?
Right. And you have to think about what's the risk of dying from your heart disease or getting Alzheimer's or dementia. So you have to weigh those things too that we know estrogen is so important with.
50% decreased risk of fracture, even in people who do not have a diagnosis of osteoporosis. Now, the diehard poo-pooers will say, because they learned this in med school, they learned that the randomized controlled, placebo-controlled trial is the best trial out there. So that's what we need. Like, the Women's Health Initiative was $1 billion, massively flawed, caused significant harm. These medications we use now aren't even the same ones, right? They're generic and cheap. Who's going to fund another $1 billion 10-year study? And furthermore, do you want to wait around for that? No, my women need to make decisions now. We're not going to get hold your breath, man. You'll die holding. It's not going to happen.
Yeah, we have to take what we have and think about the individual woman and quality of life. But I think all your points are valid and too about the being sued, right? Like you don't want to be the one doctor. You risk what that looks like being the doctor prescribing estrogen for breast cancer patients if the public thought is that it increased your risk of breast cancer.
I mean, it really comes down to education, which you can't do in 10 minutes in a doctor visit. So, I mean, the women who are going to get this treatment are the women who are proactive and ask for it. They're women who sit around saying, my doctor will tell me if it's best for me. You're not going to get any help. And at the end of the day, doctors' unwillingness to help women is causing harm. But also, I think it's the public perspective that medicine is infallible. Medicine is not infallible. All medications have risks. People have side effects. Cancer comes back. Being okay with this being imperfect.
Everything has risk. Nothing's 100%, right? That is where we are. Well, what about testosterone? Because I feel like I'm very ignorant about testosterone as a woman. And I feel like I'm seeing more of my patients on testosterone and what happens to women's testosterone levels during life, right? I think for some people listening, they might say, wait a minute, women have testosterone, right?
So women have 4 times the amount of testosterone than estrogen.
That is crazy.
I didn't get taught that in med school. I was like, literally my jaw dropped. So I checked my blood levels. And you have to calculate nanograms per deciliter, which is testosterone, into picograms per milliliter, which is estrogen. So you actually have to convert them. And once you convert them, you're like, no shit, I have more testosterone in my blood than estrogen. This big stigma that estrogen's for women and testosterone's for men is like, no. That's just a way oversimplified and wrong. So women have 4 times the amount of testosterone than estrogen in their bodies. They just have like anywhere between 7 and 20 times less testosterone than men have. Men just have a shit ton of testosterone. The other interesting, I can't say that without also noting, a postmenopausal female has less estrogen in her body than the male does.
That is crazy.
So I had this woman, she was transformed by a low-dose estrogen patch. She started painting again. She started smiling again. She started wearing colors. Transformed by a low-dose estrogen patch. And I'm like, congratulations, I've given you the estrogen of your husband.
That is so crazy that my husband's going to have more estrogen than me in 10, 15 years.
Yep, totally. Yeah, so testosterone starts to go down more linearly after our 20s. Everybody's like, what happens after testosterone? And like the true stickler will be like, nothing happens to your testosterone on your day of menopause because it's just kind of a slow decline. So we don't know why. We know that women later in life live longer. If they have less heart disease, they have less major adverse cardiovascular events, they call MACE. Women with naturally higher testosterones later in life. And testosterone tends to actually start going up again in our 70s. We don't know why. Save your $1 billion and actually study that stuff, right? Like, I don't need another study to know that an estrogen patch is effing safe. But why does testosterone start rising again at age 70? Let's figure that out. So testosterone's been studied, and it's very robustly studied, meaning dozens of studies correlating testosterone to libido and overall well-being. Well-being and feeling like yourself are kind of these soft things that like we don't care about too much in medicine, but I would argue is what makes you you and is vitally important. So lots is in the realm of like self-esteem, sexual function in general, not just libido, but orgasm, arousal, all domains of sexuality. Because Western medicine has failed women in not providing a female dosed product that's FDA approved and covered by insurance, and there's a couple reasons for that, women are being pushed into the pellet market. And if that's your only place to get testosterone, I get it, but it tends to be super therapeutic, very high levels. That's where they come to the derm saying, oh shit, where's my hair? Because the hair is very sensitive to large fluctuations, whether that's weight loss, whether that's a hormone change, whether that's a thyroid storm, right? Like hair follicles hate rapid change. So no testosterone to pellet level testosterone, not good for the hair follicle, right? So that's where testosterone gets the bad rap. It'll make your hair fall out. And it's like, not if you dose it appropriately. And then some people I think are just predisposed to converting their T to DHT. And we haven't truly figured out how to catch that. So, but a physiologic dose testosterone where I'm trying to get you to 60 instead of 250, you're probably going to have way less androgenic side effects. So the Intrinsa patch went up to the FDA, I think, in 2004. Lots of studies on this female dose testosterone patch. I think they brought 2-year safety data at the time. Now, keep in mind, we've been giving testosterone to women since the 1940s, but 2004 was 2 years after the Women's Health Initiative. So we were freaked out, right? Habits trial was stopped. Testosterone came up. They said, nope, we don't have enough safety data. So it was really this environment. Also, the FDA has a bias, a gender bias, right? Like, rumor is somebody at the FDA said, what do we need a bunch of horny women walking around for? Yeah, I was not there. I just pass on the story. So there is some gender bias. Viagra was approved in 1998.
To your point, who are the partners of these people who are taking Viagra?
Exactly. Viagra was approved in 1988. I think with 6-month safety data. Male testosterone was approved with 6-month safety data. And they told these testosterone companies they wanted 5-year safety data. That's $1 billion to get a 5-year safety data study on a testosterone product. It's $1 billion study. And these testosterone's generic, right? There's not a huge markup for this. So if you were a company, would you say that was a viable product? If you had to do $1 billion study to put something on the market? So it was dead in the water.
So where do we go from here?
They're trying again. There's a couple of companies that are going to try again. I just think it's a much more favorable time now. The Women's Health Initiative, women are understanding hormones, because people like us are actually getting the word out. They're understanding testosterone. We have a lot more older women now who care about quality of life. So I just think 20 years on, it's going to happen now.
It's a good time. I'm excited to be like a midlife woman now because I feel like I do see women saying like, wait a minute, I'm not going to just live my next 40 years in declining health and I'm not going to accept that. So I think it's exciting. And yeah, I mean, that blew my mind about testosterone. I had no idea that I had more testosterone than estrogen and that my husband was going to have more estrogen eventually than me. So that is just mind blowing. And I'm a doctor.
I know. So we didn't get taught this. I remember from med school, it was like, this estrogen goes up mid-cycle and you ovulate and then it goes down and then your progesterone goes up. And it's like, there's no testosterone involved in that. But testosterone also goes up when you ovulate.
When women think about acne and things like that and changes, that could be from that. But yeah, you're right. Like testosterone was never on that chart that we needed to know. And that's crazy. But I'm glad we're now talking about it. I have learned a ton. Kelly, this has been a lot of fun. We didn't even really dive into sexual health, right? Like that's a whole nother podcast episode, isn't it? Probably more fun, but
I give a lot of these talks and I give talks in public. And every time, even when I give a sex talk about desire, talk about libido, talk about clitoris, talk about all those things, vaginal estrogen, it comes back to hormones. Women are insanely thirsty for information about testosterone and estrogen. So I think it's not bad that we diverted off of that. If they want more, they can come follow me for more sex stuff.
That's right. And your new book, what's your new book about?
Yeah, so the current book is You Are Not Broken, Stop Shooting All Over Your Sex Life. You can get that on Amazon and some Barnes & Noble. And then the new book, which will be out probably end of 2025, doesn't have a title yet, but it's very pro-hormone. Because I'm just saying, you probably get this too, is like, how much stuff do you read that says like, but go talk to your doctor, but go talk to your doctor. And I'm like, this is just going to be a hell yeah, Here's the data. And estrogen's good for your body. So is progesterone. I support you if that's what you want to do. Because I'm like, the world doesn't need more people saying, go talk to your doctor. The world needs women understanding that how their bodies work, and hormones help the body work.
This is one question I have. Why are they always patches? Estrogen, testosterone, just better absorption?
There's no testosterone patch.
Okay. Or that what they were looking at.
Oh, why did it? I don't know. Maybe it's a easy, cheap delivery method. I don't know. But I mean, estrogen patches they're lovely. You don't have to take a pill every day. They're just transdermal, safer than oral. They're relatively cheap. Estrogen patches are teeny.
I've seen them on my patients. It's interesting to me that estrogen patch is absorbed transcutaneously, but yet the vaginal estrogen isn't, and it's mucosal. I always thought that was
Dosing. It's just a bigger dose. Everybody's always like, I don't understand it. I'm like, dosing.
yeah, that's true. And now everyone's putting their vaginal estrogen cream on their faces. So I'm all for that too. So,
Oh, yeah, it's so good.
well, where else, you shared a little bit, where else can listeners find you, follow you, and connect with you?
Yeah, well, I hang out on my podcast at You Are Not Broken. The Instagram is Kelly Casperson MD. And come see me if you want to see me for a clinic. I'm opening the Casperson Clinic, Washington State, spring 2025. Get on the waiting list.
So exciting. Lots of amazing things. I'll definitely include all that in the show notes. And I so appreciate you coming on. Thanks so much, Kelly.